Knock, knock.
Hi.
Hi, I'm Hannah. I'm going to be your nurse today.
Mm-hmm.
I'll go ahead and wash my hands. Can you tell me your name and date of birth?
Karina Duran, 1/22/99.
Perfect. That's what I got there. Welcome. Today we're going to be doing an assessment of your body, just to get a kind of a good baseline to make sure there's nothing going on, and if there is, things that we can follow up on. How does that sound?
That sounds good to me.
Perfect. So when you first came in, we had them do your vital signs. Everything came out looking within defined limits. No issues with your heart, your blood pressure, temperature. Any concerns there?
No concerns.
All right. Have you been having any pain?
No pain.
Any issues with bladder, bowel movements?
Mm-hmm. Everything's been regular.
Sounds good. So throughout our whole assessment, it's going to be from head to toe. We're going to be checking your skin temperature, different pulses. Probably go a little bit out of order with that, okay? But I'll let you know before I do anything, and I don't want you to be afraid. Ask questions, all of that kind of stuff. Sound good?
Mm-hmm.
All right. So first I'm going to have you put your hands out like you're at the salon. Perfect. We're going to check your hands. I'm going to look at your fingers. They look good to me. Convex. Cuticles are good. Not any problem areas that I see. Excuse me, you're going to need to wait for your appointment. Thank you. Your capillary refill is less than 3 seconds. Perfect. Skin is all the same color. Your skin feels nice and warm. No moist. Turgor is good. You seem pretty well hydrated. Good. All right. Yes. Please wait your turn. Apologies, everyone. I'm going to start with your head, and we're going to inspect your head and skull. I'm going to have you lean forward to me. Thank you. All right, I'm not feeling any lesions. No bumps. Any pain?
No pain.
All right, I see your head is nice and normocephalic, nice and round. Your hair is evenly distributed, not too dry, not too oily. Looks like it's nice and straight. It is up, but I see from the strands here, your hair is pretty straight, evenly distributed. Sounds good there.
Mm-hmm.
All right, I'm gonna go ahead and look at your face. So I see your eyes are in the top third of your face, your lips are in the lower third, and your nose is in the middle. And your ears also look symmetrical to your nose. Looks pretty good for me. All right, so I'm gonna feel your sinuses.
Mm-hmm.
You got your frontal sinus and your maxillary sinus. Any pain?
No pain.
Perfect. Okay. I'm gonna go ahead and look at your eyes. I'm gonna have you pull your glasses down for me.
Of course.
All right. Let's see here. I'm gonna shine a light into your eyes. So I'm gonna have you look here. I'm gonna check your pupils response. Good. All right, your pupils are equal, round, and reactive to light. And now we're gonna check about accommodation. So I want you to keep looking here, straight at me, okay? And I want you to follow my light. I went a little bit out of order that you might be used to.
Mm-hmm.
I like to keep it a challenge. All right, and they are accommodated. I don't see any drainage. Beautiful eyeliner. All right, nothing there to worry about. Next, I'm gonna have you look up. I'm gonna look up your nose, everyone's favorite part. All right, I don't see any extra drainage. Your septum is midline. I do note 3 piercings. What I'm gonna have you do is I'm gonna have you block your right nostril and breathe in through the left. And now the other side. Your ears are nice and patent. I'm gonna have you go ahead and turn your head to the side, and I'm gonna look at your ear. Do you mind if I pull your hair back?
Of course.
All right.
It always gets in the way.
That's okay. And I got couple piercings over here. All right, your ears are nice and elastic. I only see a little bit of cariemen on the inside. Sorry. And same story on this side, but 1 extra piercing.
Mm-hmm.
All right, they're warm to touch. Now for both your eyes and your ears, we have the, what's it called? The ophthalmoscope. I don't have one of those with me today. For your eyes, we're going to be looking at the retina, and with your ears, we look at the eardrum. If you feel that is something you need, you can follow up with your primary care, okay?
Okay.
All right. Now we'll look at your lips. They do look a little bit dry, but that's okay. As you can tell, mine are as well. They're nice and pink. I'm going to have you go ahead and smile for me. Your smile is symmetrical. Go ahead and open, say ah, and stick your tongue out for me. Ooh, try that again.
Ah.
All right. And then go ahead and lift your tongue for me. Alrighty, I'm gonna just look at the gums. Perfect. Everything looks nice and moist in there. Your gums look pink, your tongue looks pink. On the dorsal side, you got the nice roughness from your taste buds. And on the ventral side, man, your appointment is after you're gonna need to leave the room. Thank you. On the ventral side, I apologize. Sometimes our clients get a little impatient.
Mm-hmm.
Nice and veiny. Your uvula is midline. Your tonsils do not look inflamed, so I'm going to give them a +1. I do note you do have your tonsils.
Mm-hmm.
Ma'am. Please leave. Thank you. Anyway, neediness of some nurses. Okay, back to where we were. Next, I'm going to check your lymph nodes. There's a few of them. I'm going to be doing some palpating, okay?
Mm-hmm.
Okay, I apologize. My hands might be a little clammy.
Don't worry.
So here we got your pre-auricular. We got your posterior auricular
Mm-hmm.
and your occipital. I have your tonsillar. There's a bigger name for them. I never can remember. You have your submandibular. I've got your mental, submental. Then we have your superficial clavicle, cervical, superficial cervical. And down here, I got like the posterior cervical
Mm-hmm.
chain. I've got your subclavicular. And then we have the deep cervicular cervical chain. I don't feel anything protruding. I don't feel any swelling. So that tells me your lymph nodes are all doing well. We don't need to follow up on that at all. Okay. Okay, so we've gotten from here up. The last thing I'm going to do while we're up here is I'm going to check your carotid arteries to make sure that everything's flowing. You are having a conversation with me.
Yeah.
Nice, alert, and oriented, ×4. Good, normal affect. All right, I'm going to listen to your carotid arteries. So I'm going to tell you when. I'm going to have you hold your breath on 1, 2, 3. Okay. And 1, 2, 3. All right. So they are equal, 2+ bilaterally for your carotids. I don't hear any bruits, which is a good thing. So nothing to follow up with there. Okay. All right. So I'm going to start with your thorax, upper chest area. Okay. I am going to take a little palpating. I want to see if I feel any vibrations. Everything feels good. I'm going to have you lift your arms a little for me. All right, so your anterior and posterior chest in regards to your lateral side is 2 to 1, which is what we want to see. So that is very good. We're going to check your skin turgor again, which I did on your arms. Everything looks good, telling me you're hydrated well. Your skin temperature is doing well. So next we're going to take a look at your back. I'm going to do a few things. Go ahead and turn for me.
Sounds good.
I'm going to listen, I'm going to look, I'm going to tap. I'll tell you everything I'm going to do before I do it. Let me go ahead and look forward for me. First, I'm going to have you bend forward, and I'm going to check your spine. Sorry. All right, so your spine is midline. When I was looking from the side, it does look like you have that S curve going, which is good. Are you having any back issues that you know of?
Oh, no.
Okay.
No back issues.
So next what I'm going to do is I'm going to do some tapping. We call it palpating, and what I'm looking for is if I hear a dullness or if I hear any fluid, phlebitis, any pain. I want to hear a little bit of a good echo there, okay?
Sounds good.
All right, we're going to do this a few times. Okay. Painful?
No, I'm just ticklish.
Okay. All right. Everything seems good there. I don't notice by percussing any sort of fluid buildup. I'm going to give it a listen next. When I tell you to, I'm going to have you take in a big breath and let it out, okay?
Sounds good.
Big breath in. Again. Again. Okay. So the vesicular sounds are present in the posterior lungs, all lobes, all fields. Exactly what we want to hear. I don't hear any adventitious sounds, so to me it sounds clear. Doesn't sound like there's any fluid buildup, any other issues going on there, okay? So what I'm going to have you do is I'm going to have you turn. Hello. We're going to listen to the front. Okay. I'm basically going to do the exact same thing again. I'm just not going to percuss this time, okay?
Sounds good.
Okay. So from the anterior, the front side, and from the sides or the lateral sides, I've listened in 10 places in the front and the back, and 2 on the sides each. I'm not hearing any fluid buildup. I'm not hearing anything I shouldn't. Did any of that hurt?
No.
Okay,
Okay.
sounds good. So we're going to do your chest next again, but this time I'm going to be listening and focusing on your heart. So I want to, let me try that again. From first inspection, everything looks symmetrical. Your breathing looks symmetrical. I don't see one side moving more than the other. I don't see any pulsations. One place I'm going to press is right here, nothing there. Okay. So we should feel a little bit with our apical pulse there. There's a little pulsation, nothing extenuous that is anything to worry about. Okay. No, you just breathe normal. This is our aortic. Now we're going to do pulmonic valve. I'm going to go to the Erb's point. I'm going to go to the tricuspid. I'm going to go to the mitral valve, which is, and while I'm down here, I'm going to listen for our apical pulse for a full minute. I'm going to listen with the other side of my stethoscope. I've already listened for a full minute. Your beats are at 76 per minute. Good. All right, your apical is not bounding. I noted S1 and S2. S1 I hear more when we're at our mitral valve, and S2 at our Erb's point. Everything sounds good. I don't hear any signs of a murmur, and I didn't note any S3 or 4 heart sounds. Okay.
Sounds good.
All right. So next up, we are going to take a look at your abdomen. Now, you did say you had no issues with any bowel movements or urinary tract issues, correct?
Correct.
All right. So we're going to have you pull your shirt up and lean back. All right. So from first inspection, I don't notice any bruising. I don't notice any edema. I don't see anything out of the ordinary that we're looking for. So next, I'm going to listen to your bowel sounds. All right, your umbilicus does look like it is midline and inverted. I don't notice any pulsations. We're going to listen for 2 minutes in our first quadrant here. And while we're listening, I'm going to listen for a total of 5 minutes. All right. So it does sound normal active. Everything's moving well. Sounds like your dinner is working its way through your system, so that's always a good sign.
Wonderful.
I'm going to turn a little bit to get a little closer. I apologize. So next I'm going to do some palpations if you want to keep leaning back. I'm going to check for any tenderness. When I lift up, it's called rebound tenderness. I'm also checking if I feel any inflammation with any of the organs that are there, okay? So I'm going to start over here in our right lower quadrant. And this is where we're going to find your appendix. I don't feel any tenderness there. Okay, and then we're going to go to the right upper. I'm checking your liver, your gallbladder, kidney. A little part of your pancreas is hiding over there. And then on the right, left. I know my lefts and rights. You got stomach, spleen, more of your pancreas, and another kidney. You got one on both sides. Your kidneys mainly, if you're going to have any issues, you're going to feel them in your back, however. And then the left lower, we're looking for that colon, which, as we said, it's working. All right. Any trouble?
No.
Perfect. All right. I don't see any swelling there. So one of the last things I'm going to do is I need to check all your pulses. I did want to say I noted that we have a tattoo here on your arm. I did note one on your shoulder there. And I believe you wrote down you have one on your leg in your paperwork.
Yeah.
Perfect. All right, so I'm going to start with your pulses on your wrists. They're called our radial pulses. Nice and strong, equal bilaterally. I'm going to give them a 2+. All right. We did already check your cap leaf refill. This is a little bit of a weird one. I'm going to have you scooch back a little bit. I'm going to have you bring your feet up. I promise I'm not a foot fetish. I'm going to start by checking your capillary refill with your toes.
Sounds good.
They also look convex, clean, well kept. Capillary refill, less than 2. I'm going to go ahead and feel for a pulse on your foot. It's called our pedal pulse or our dorsal pedal. I can never say it. We're going to stick with pedal pulse. Good, nice, strong, equal. We're going to go 2+, and then I'm going to come around to your posterior tibialis. Thank you. All right, they are also equal, 2+. Skin temperature is good. I'm not noticing any edema or pitting. Good. All right, go ahead and relax. Do you have any other questions for today?
No, I didn't have any questions.
All right, well, thank you. We'll have your paperwork up front.
Thank you so much.
Thank you.